Hello everyone, our drug for today is going to be Cephalexin, also called Keflex. So we're going to go over patient counseling points, some general information such as the mechanism of action and different dosing for different indications, some warnings and precautions to consider, and any adverse reactions to look out for when taking this drug. So let's go ahead and start with patient counseling. So what is cephalexin? It's an antibiotic that is used to treat bacterial infection of the lungs, ears, skin, bones, the bladder, and the kidneys. Cephalexin is available as a tablet, capsule, or a suspension liquid. You may take this medication with or without food. With the suspension, there are some special instructions on how to take it. Suspensions tend to separate, so make sure to shake it well before using and measure the liquid carefully using a medicine dose measuring device such as a cup and not a kitchen spoon. And store the liquid in a refrigerator and throw away any unused liquid after 14 days. Use this medicine for the full prescribed length of time, even if your symptoms quickly improve. Skipping doses can increase your risk of infection that is resistant to medication. Cephalexin will not treat a viral infection such as the flu or the common cold. Some possible side effects that you may experience with this drug include stomach pain, diarrhea, nausea, and vomiting. And then some serious but rare side effects. Definitely call your doctor at once if you start to experience any severe stomach pain, diarrhea that is watery or bloody, or any signs of allergic reactions such as hives, difficulty in breathing, swelling in your face or throat. And then we're going to go ahead and talk about some general information about cephalexin. So cephalexin is under cephalosporins. Cephalosporin is a broad-spectrum antibiotic used to manage a wide range of bacterial infections. They are derived from the mold Acremonium, previously called cephalosporiums, where they derived the drug name or drug class of cephalosporins. Cephalosporins are grouped into 5 generations based on their spectrum of coverage against gram-positives and gram-negative bacteria. Cephalexin is a first-generation cephalosporins that acts on all gram-positive bacteria such as staphylococci and streptococci and show little activity against gram-negative bacteria. So with the mechanism of action, first-generation cephalosporins inhibit bacterial cell wall synthesis and have the same mode of action as other beta-lactam antibiotics such as penicillins. It inhibits the bacterial cell wall synthesis by binding to one or more of the penicillin binding proteins, which in turn inhibits the final transpeptidation step of peptidoglycan synthesis in bacterial cell wall, thus inhibiting cell wall biosynthesis. The bacteria eventually lies due to ongoing activity of cell wall autolytic enzymes while cell wall assembly is arrested. And then for indications, you can use cephalexin for endocarditis prophylaxis. You take 2 grams 30 to 60 minutes prior to procedures. You may administer it up to 2 hours after the procedure. And then for skin and soft tissue infection, for cellulitis and erysipelas, you may take 500 milligrams 4 times daily for 5 to 14 days. And then for impetigo, you take 250 to 500 milligrams 4 times daily for 7 days. And then for prosthetic joint infection, for staphylococci methicillin susceptible, you can take 500 milligrams every 6 to 8 hours or 1 gram every 8 to 12 hours. And then you combo it with rifampin and you take both for 3 to 6 months. And then for streptococcal pharyngitis, you can take 500 milligrams twice daily for 10 days. And then for mastitis, you take 500 milligrams 4 times daily for 10 to 14 days. And then for UTI, for asymptomatic bacteriuria, you take 250 to 500 milligrams every 6 hours for 4 to 7 days. And then for cystitis, you take 250 to 500 milligrams every 6 hours for 5 to 7 days. And for recurrent infection, you take 125 to 250 milligrams once daily. And then we're going to go ahead and go over dosing adjustments. For adult patients with kidney impairment, we would have to renally dose adjust based on their kidney function. If patients have altered kidney function that have a creatinine clearance of more than 30 milliliters per minute, there's no dosage adjustment necessary, but if it falls between 15 to 30, the dose would be between 250 to 500 milligrams every 8 to 12 hours. And if it falls below 15 milliliters per minute, it's going to be dosed at 250 to 500 milligrams every 12 to 24 hours. If patient is on hemodialysis intermittently, like 3 times weekly, the dose will be administered after hemodialysis at 250 to 500 milligrams every 12 to 24 hours. And then for peritoneal dialysis, it's dosed at 250 to 500 milligrams every 12 to 24 hours. And then some warnings and precautions. So concerns related to adverse effects. Cephalexin may elevate INR levels, especially in nutritionally deficient patients, prolonged treatment, or hepatic or renal disease. Use it with caution in patients with a history of penicillin allergy, especially IgE-mediated reactions such as anaphylaxis, angioedema, and urticaria. Use with caution in patients with history of seizure disorders. High levels, particularly in presence of renal impairment, may increase risk of seizures. And prolonged use may result in fungal or bacterial superinfection. Use with caution in patients with renal impairment, modified dosage in severe impairment. And going over adverse reactions, some common side effects that we already mentioned include stomach pain, diarrhea, nausea, and vomiting. And then even though it may be rare, some people may have experienced significant adverse reactions like C. difficile as well as C. diff-associated diarrhea and colitis. It's a dose-dependent and time-related adverse effect. Cephalexin may cause disruption of the intestinal microbiota, so it results in the overgrowth of pathogens such as C. diff. The onset varies from start of the treatment up to 3 months post-antibiotics. Some risk factors of C. diff includes antibiotic exposure, older adults, and immunocompromised conditions. And then we also have immune hemolytic anemia. It occurred in patients receiving cephalosporins, but it's very rare in cephalexin use. It's not dose related and it's usually caused by an immunologic response of the body. Onset varies. It may occur several minutes up to 9 days after the first dose. Hypersensitivity reactions, immediate and delayed, range from skin rash to rare cases of anaphylaxis, which includes Stevens-Johnson syndrome and toxic epidermal necrolysis, have been reported. It's non-dose related. It's caused by an immunologic of the body. It's an immediate hypersensitivity reaction, and usually delayed hypersensitivity reaction includes maculopapular rash. Usually it occurs within 1 hour of administration, but may occur up to 6 hours after exposure. And then delayed hypersensitivity reaction may occur 7 to 10 days after initiation. There are risks. The risk factor is due to cross-reactivity between penicillins and cephalosporins. And that's it. Thank you so much for tuning in.